Hey everybody, it's Dr. Hendrix. So we just got done with our chronic pain class where we look at pain when it's set inside the nervous system, when it's not a tissue issue anymore. And we've also posted blogs on, lab panels and things like thyroid and Cushing's and vitamin D deficiency. We just had another one come in with pain. But now we want to kind of start focusing on our series of I do have a tissue issue, I do have neck pain, what can be going on with that. And remember, even with your things that are becoming chronic pain, you could have a tissue issue in the neck that's never been resolved that is leading to chronic pain, and you could have both. You could have chronic pain that's coming from a vitamin D deficiency that's caused your nervous system to be sensitive. So it can be a big cycle, but today let's just focus on things that are causing neck pain. Interesting fact, 75% of the population will experience neck pain sometime in their life. So that's pretty significant. Reason why most of our patients seek us with neck pain is, tension, stiffness. We get it a lot, I can't move my neck anymore. Some of them will have, radiation down the arm. Some of them will have disc bulge type symptoms. My work posture, my desk is hurting me, things of that nature, can't drive, car accidents because of whiplash, things like that. So you should seek a chiropractor for the things that we're talking about above. We can always help with the nerves, the muscle, and skeletal system. And what we mean by that is, stiff neck, can't turn my head, got radiation down the arm. We'll get into this a little bit on this talk right here. Disc injuries, facet joints, whiplash, car accidents, headaches can originate from the neck too. It's quite fascinating. You can even sometimes have dizziness coming from the neck, and we actually have orthopedic tests to rule that out. And we put a study here looking at treatment after 12 weeks from chiropractic, and then also looking at it, long term down the road as well. And you kind of become familiar with our process. We listen to you, we gather a thorough exam. We've gathered quite the reputation for being very different with how we approach it, because we don't just assume anything, and that's how we've been able to catch all these vitamin D deficiencies and Cushing syndromes and thyroid problems. And now we're even starting to ask toxin questions and stuff like that. So we do a really good job of listening to you. Once we know what's going on, then we address the root cause, not just the symptoms. Then we rehab you, get you back. Typically about 6 to 8 visits, our patients are pain-free, and then we use the next month after that to rebuild you with exercises and soft tissue. Frequently asked questions with headaches is, what are some things that I can do in my life to help my neck pain? And it's real fun. It's real interesting, sorry. I had a patient, and this was when I was a personal trainer before I was a chiropractor, and I was personal training him, and he told me, hey, my neck hurts all the time. And I just asked him some question, well, what are you doing the most that hurts your neck? And he's like, oh, at my desk and stuff. And I was like, well, is there like a weird angle or what's going on? And he's like, now that you mentioned it, I actually have a monitor, and I always have to look right at that monitor, and that's aggravating my neck. And just from a lifestyle switch of keeping the monitors more in front of him, where you didn't have to twist his neck repetitively, made that person's life significantly better. So there's things like that. Neutral pillows, it's very hard. Some people are like, is there a perfect pillow? It's really person dependent as well. The interesting thing is, once our nervous system creates a problem, it's really, really tough to decide what like a perfect standard would be, and we have to tailor those exactly to that person, because some people may do good with their head more flat or down, some may do better with their head in a different position. So other things that you can do, making sure you have good headrest support on the car, especially if there's an accident, so that way you actually have something to catch you when you whip back. Brakes are so important. And one thing that we didn't put on here is strength training. A lot of people miss that. And your rows, your horizontal pushes, your horizontal pulls, vertical pushes, vertical pulls, those are super important. And then doing your little correctives. Don't just work the show muscles. Work your lower traps, work your upper cross muscles. Tech neck has become really common in there. I think there was one that was linked to is my child using his cell phone causing him to have horns? Like an osteophyte that formed on the neck. That gets kind of thrown around a lot there too. Can I still be seen for chiropractic if I have a disc bulge? Absolutely. If you were with us on our chronic pain talk, you'll know now that a lot of people have disc bulges and they've never had pain in their life whatsoever. The other thing is that we've seen disc bulges reabsorb as well. And by we, I mean the research articles, PhDs, MDs, or people writing these spontaneous reabsorptions of disc bulges. And that's all depending on if they get the right type of care, whether it be from a chiropractor, a physiatrist, or a physical therapist at the right time with exercises as well. So yeah, you can absolutely be seen. We put a study here. We typically see about 80 to 90% success rate with patients with a disc bulge. There's always those little confounding factors, that we've talked about with the thyroid and how bad it is. And, if there's complicating factors with other surgeries or a lot of damage in the joint, it can affect it. Some of the cases that we struggled with a little bit, the patient had an anterior and a posterior fusion of the neck. They'd also had throat cancer. They had Lyme's disease. They had hepatitis. So those types of conditions, like that all plays into like if you're going to respond well or not. But we were still able to get that person where they could actually work out pain-free. So yeah, it's quite fascinating. But we can absolutely help with disc bulges. So it's really interesting. What conditions cause you to get nerve pain in the arms and hands? And this is something that I talk with my interns about a lot. So when you're looking at nerve pain, you always have to rule out your red flags. And this is one of the things that will help you to know to go to a chiropractor or not. If you're having face and neck numbness and you're getting numbness down the arms and you're having facial drooping, you're having signs of like stroke and stuff, yeah, go to the ER immediately, get that taken care of. If you've lost complete control of your hands, if this is like new from like a car accident, it would be good to get imaging immediately, especially if it's like a new onset of nerve shooting pain immediately post car accident, because we want to make sure that we don't have like a cervical instability. But once those bigger things are ruled out, and sorry, my dog may bark here, so once we have these bigger conditions ruled out, then we can start getting into like our bread and butter. So when you get away from the ominous stuff and you start looking at what can cause nerve pain that we can help with, trigger points, there's a big one. Your infraspinatus, your muscles right here in your rotator cuff, you can push on it and it'll shoot down the arms. I always start there on my exams. You could have a local disc bulge in the neck that's causing the shooting pain. The interesting thing is your facet joints, so your joints in the back of your spine and in your neck, they can actually shoot down. Typically they'll have a unique pattern kind of down to the arms and maybe even down to like the mid-back type stuff. And we've got some other more deep like vitamin D deficiencies and other stuff that can cause the nervous system to be sensitive to shooting, but those are the big ones on that one. Really interesting, degenerative joint disease can eventually lead to collapse of the disc, which then can cause the nerve pain shooting down. But we're seeing more and more that wear and tear arthritis is more like wrinkles in the body, and it's a more common thing as we've seen. And as you get older, you have more highlight incidents of it. So if you weren't with us with our chronic pain talk, just remember, just because you have findings on your imaging doesn't mean it's clinically relevant. And even if it is clinically relevant, we've seen people with these same findings live a normal, happy, healthy, fully functional, pain-free life. So you can too. Whiplash is mentioned a lot. Football players, car accidents, and that's when the head does a sudden jolt back. And so basically what will happen is you'll get a sprain strain. Strain is the muscles tearing, and the sprain is from the ligaments tearing. That happens a lot in car accidents or violent like head movement type stuff, and it can happen laterally too, and even in rotation. So it affects different muscles depending on which way you're hit and things of that nature. It takes about 2 months for a sprain strain to heal, but we can absolutely get that done and taken care of. And the other important thing on these is to make sure that we've actually rebuilt the tissue, because you can get people out of pain, but until you do that last month of actual strength training, head movements, rowing, stuff like that, harder chin tucks, skull crusher type stuff movements, the tissue won't be ready to go back to normal life, and it can reoccur. Torticollis, called wry neck. There's 2 different types because you'll see it a lot in infants, post-birth trauma, but adults can also get it too. These are people where the neck locks down. It's really interesting on this one. Some of them have mentioned that jelly donut, that disc material that sits between your bones, sometimes it can tear some of the material, but not fully out where it's actually bulged or ruptured yet, and that can cause it. It's kind of hotly debated why it causes it. You know, it can just be from muscle spasm stuff. So if you have a sensitive nervous system, it can do that as well. So going in there, releasing out the muscles. What services do we specifically offer to get people better? We do hands-on work for muscle, almost like massage and soft tissue. Love to do tools, cups, and hands. If it's really pesky, we can move up the soft tissue to even dry needling. After that one, we always do adjustments. Our bread and butter with rehab is we move past just stretching. And, you know, there's a big debate whether stretching is actually causing a growth in the muscle tissue, just from the tensile load. But we really seen the big benefit is from actually strength loading people. And this was just one of our reviews that we had in there. Alright guys, so this was just a little quick rundown on neck pain and what we can do for it. You know, we have videos on neck stretches as well too, and we have more blogs that you can go in deeper than that one. If there's any way that we can help, just let us know and schedule an appointment. We hope this was helpful. Thank you guys. Take care.